Finally, we have the peripheral pulses. Remember, the sequence at which the peripheral pulses get transmitted is the carotid pulse, followed by brachial pulse, then the femoral pulse, and then the radial pulse. Since the difference in sequence of transmission is in milliseconds, you can't really appreciate the sequence by palpating these pulses. To palpate the peripheral pulses, you are going to use three fingers: the index finger, the middle finger, and the ring finger. With exception of carotid artery, and at some literature, it has been written brachial artery as well, for which you use your thumb. However, in some literature, it has been mentioned that you are not supposed to use your thumb to palpate pulsations because thumb has a strong pulsation of its own. So if you use your thumb to palpate other arteries, you might feel the pulsation of your own thumb rather than feeling the pulsation of the artery that you are trying to palpate. But for now, just remember, for all the pulses, we are going to use these three fingers, and for carotid artery pulse and brachial artery pulse, we are going to use the thumb. Starting off with the carotid artery. So the location of carotid artery pulse is at the intersection of the anterior border of sternocleidomastoid muscle and the superior border of thyroid cartilage. So right here is the intersection between the superior margin of thyroid cartilage and the anterior margin of sternocleidomastoid muscle. So this is where you are going to keep your thumb and palpate the carotid pulse. The carotid pulse is palpated against the transverse process of cervical vertebra. Okay, so below here I have shown you how to palpate the carotid pulse. You use the thumb of the opposite hand to palpate the pulse. That is, if you are palpating the right carotid pulse, you use your left thumb, and if you are palpating the left carotid pulse, you use your right thumb. That kind of comes off naturally as well if you try to palpate the pulse. Remember, while palpating peripheral pulses, you palpate the pulse on both sides simultaneously, that is the right and left pulses simultaneously, to compare and contrast between the two pulses. But you never do that for carotid artery, because if you palpate and press upon the carotid artery of both the sides simultaneously, it might lead to cerebral perfusion. It might lead to reduced cerebral perfusion. Okay, next is brachial artery. The brachial artery is present in the cubital fossa, medial to the biceps brachii tendon. So here's the cubital fossa, here's the biceps brachii tendon, and medial to the biceps brachii tendon is the brachial artery. So you either use your thumb or the index finger and the middle finger to palpate the brachial artery present medial to the biceps brachii tendon, to palpate the brachial artery which is present medial to the biceps brachii tendon. Next is the radial artery. The radial artery is palpated on the wrist, on the anterior surface of the wrist, lateral to the flexor carpi radialis tendon. So the radial artery is present lateral to the flexor carpi radialis tendon. So you grab the arm of your patient, and at rest it should be semi-flexed, and at elbow it should be semi-pronated. A semi-flexed wrist and a semi-pronated elbow. With semi-flexed wrist and semi-pronated elbow, you palpate lateral to the flexor carpi radialis tendon. Here is going to be your radial artery. And you use your three fingers, the index finger, the middle finger, and the ring finger. What's the function of each of these fingers? The index finger, it blocks the return of pulsation from the palmar arches. The ring finger It stabilizes the artery over the bony prominence. And it is the middle finger that is actually used to palpate the pulse. Again, the index finger is used to block the reflection of pulse from the palmar arches. The ring finger is used to stabilize the artery over the bony prominence, and the middle finger is actually used to palpate the pulse. You need to palpate the pulse on both the hands simultaneously to compare and contrast between the pulses to see if there is any radioradial or radiofemoral delay. Up next, we have the femoral pulse. Femoral pulse is palpated at the mid-inguinal point just below the inguinal ligament. You can palpate the femoral pulse and the radial pulse simultaneously to see if there is any radiofemoral delay. Next is your popliteal pulse. The popliteal artery is present in the popliteal fossa, and the fossa is present behind the knee. Within the popliteal fossa, you have the upper triangle and the lower triangle. You palpate for the popliteal pulse in the lower triangle, in the lateral half of the lower triangle. Because as the popliteal artery travels from the upper triangle to lower triangle, it moves from medial to lateral. That is why you press in the lower triangle on the lateral aspect. So to palpate the popliteal artery, it is difficult as compared to other pulses. It is more difficult to appreciate. What you need to do is keep the patient in supine position, flex the knee, and then strongly press over the lower triangle in the lateral aspect. Next is the posterior tibial pulse. The posterior tibial artery is present around 2 cm behind the medial malleolus. It is present around 2 cm behind and below the medial malleolus. So you palpate it around 2 cm behind and below the medial malleolus. One trick that I am gonna tell you is that to palpate posterior tibial pulse, you ask the patient to perform plantar flexion. When there is plantar flexion, the posterior tibial artery becomes lax. Because if it is dorsiflexed like this, the artery would be stressed and it would be difficult to palpate the pulse. You can palpate both the sides simultaneously to compare and contrast between the two posterior tibial pulses. Then you have dorsalis pedis pulse. The dorsalis pedis artery is present lateral to extensor hallucis longus tendon. So the pulse is felt lateral to extensor hallucis longus tendon against the navicular bone. Lateral to extensor hallucis longus tendon against the navicular bone. Lateral to extensor hallucis longus tendon, lateral against the navicular bone. So here for dorsalis pedis artery, you ask the patient to dorsiflex, so that the artery becomes lax and you can better palpate the pulse. You can compare and contrast between both the sides. And with that, we are done with pulse.